Hi everyone, welcome to the recall session of microbiology for the FMGE December 2021 session. Now, first of all, certain disclaimers here, as I hope you all understand that this is just a recall based on the information that was given by the doctors who have taken this exam in this session, right? So the framing of the questions would obviously be different, as well as the options. I cannot say these were the exact options. So we are basically going to talk about the correct answers. So let us begin our first question. So dear friends, the first question says that a person went for trekking on a mountain and had a bee sting. Later, the person developed edema, redness, etc. The antibody responsible from among the following is. I hope you all have identified that this is a classical case of type 1 hypersensitivity, right, doctors? Because they have talked about an insect bite, so we are going to assume that this is nothing but a type 1 hypersensitivity. The antibody responsible for the type 1, it is nothing but IgE antibody, right? So the correct answer to this question would be IgE. All right, dear friends. Now, asthma is one example for this. We have said the allergic reactions, anaphylactic shock, etc. All these things come under type 1 hypersensitivity example. Now, this in general is an important topic for examination, and this time was no exception. They've asked a question on hypersensitivity. This also is technically about hypersensitivity. So in RH incompatibility, the mechanism that is involved causing the reaction. So to solve these questions, what we will do first is, let us remind ourselves under which hypersensitivity types is this RH incompatibility included. Okay, so RH incompatibility, since it is related to the blood, it will come under type 2. If you guys remember, there was this mnemonic that we have learned earlier called by the name of A, B, C, and D. Okay, where I said the A stands for allergy or anaphylactic reactions. The B would be for the blood, meaning anything related to the blood would be a type 2 hypersensitivity. The C would be for complex, right? The immune complex deposition. And lastly, the D here would stand for delayed type of hypersensitivity. All right. So since they're talking RH incompatibility, which is related to the blood, we are going to assume that this is nothing but type 2 hypersensitivity, right? Now, the next thing is the mechanisms that are involved. I'm sure you're all aware of this other word called as acid, which is for the mechanisms of hypersensitivities, right, doctors? So what are the different mechanisms involved? A for anaphylaxis, C for cytotoxicity. That means type 2 hypersensitivity, it is related to cytotoxic reactions, meaning there is damage to the cells. All right. I for, again, immune complex deposition. So I have already said C is complex, and D is for the delayed. So whether you remember this or that, right? Either ways, you should have been easily able to answer this question if you knew this basics. All right. So here, friends, the correct answer would be cytotoxic type of reaction. Next one, dear doctors, the earliest cell that is involved in inflammation amongst the following is. See, what do we understand by the earliest cell? See, first of all, you should all understand, if they're talking about inflammation, which is early, it should be acute inflammation. And we have learned that in acute inflammation, who's the cell that does the job? Neutrophil, right? So the correct answer to this question here is obviously, without any doubt, neutrophils. All right, doctors. Now, if you see here, even the cells like macrophages and lymphocytes are involved in inflammation, but that inflammation is chronic inflammation. All right, next question. A child has complaints of recurrent infections. Investigation shows thymic hypoplasia. Hypocalcemia was also seen. Now, some of the students have also told me that there was a mention of tetralogy of Fallot. All right. So I'm not sure if that was mentioned. Then again, that is an added point that is hinting you towards this diagnosis. Which of the following diseases is associated with this scenario that is mentioned here? All right. So guys, please see here the catchy word, if you can pick up, this would be thymic hypoplasia. Okay. Now with the thymus in immunology, we have studied one disease by the name of DiGeorge syndrome. Now remember, DiGeorge, I said die for two. Everything is happening in twos in that disease. DiGeorge syndrome, the issue is in chromosome 22. Now you can remember during the embryological development, these people have defects in third and fourth pharyngeal pouches. So what happens because of this is that, okay, they're not able to develop the thymus well. So that's why there is thymic hypoplasia. And then there is even a defect with parathyroid gland. And as we all know, the parathyroid gland is responsible for producing the hormone called as parathormone, which in turn is responsible for maintaining the calcium in the body. So what happens is, if PTH gland is not well developed, obviously the parathormone would be less. And if that is the issue, then obviously the calcium levels would also go down. So that's why you see the hypocalcemia in DiGeorge syndrome. Another thing that you should remember, doctors, there are even cardiac defects associated with this disease called as DiGeorge. Okay. Correct answer for this question is DiGeorge syndrome. Next question. A patient presented with discolored patches on the skin. Okay. Microscopic image of the organism shows spaghetti and meatball appearance. So I was told that this appearance was also mentioned, as well as an image was also given along with this. So there's nothing more they can do. They are technically serving you spaghetti and meatball on a plate, right? So the correct answer for this is nothing but Malassezia furfur. So if you guys even remember what we have discussed in the last minute revision, that also I have clearly mentioned that these things are quite important for your examination. All right. So Malassezia furfur, this would be the correct answer. In this image, you can very clearly appreciate that there is this spaghetti as well as meatball appearance. Okay. Next question. A patient came to the hospital with complaints of fever and headache. On examination, black necrotic area was noted on the bridge of the nose, along with swelling on one side of the face. What is the most important risk factor involved in this infection? Now, guys, in this, with the black necrotic area on the bridge of the nose, right? It's a very classical identification of this thing that became very popular recently called as mucormycosis. All right. So they are clearly describing you about mucormycosis over here. And then they're asking you what is the most important risk factor for this. Although there are many other risk factors, like, any immunocompromised state, either due to use of steroids or whatsoever, iron chelators, etc., malignancies. But amongst all of them, the most important factor would be diabetic ketoacidosis. So uncontrolled diabetes levels are one of the most important factor for developing mucormycosis. So if you see our notes also, the very first thing I've mentioned there is in the clear words DKA, right? So this is the thing that you should remember, doctors. So in the last examination, what they've done is they've asked about the microscopic appearances of mucormycosis. See, we have learned that Aspergillus and mucor. So basically mucormycosis like Rhizopus, Apsidia or mucor, these guys produce hyphae. So we differentiate them based on hyphae. Aspergillus has septate hyphae. Septate means they are going to be clear demarcations like this. Imagine our fingers like that. So you see this demarcation, these are like septate. and the branching angle for Aspergillus would be 45 degrees. Okay, so that's the branching angle for Aspergillus. So when you compare it with mucormycosis, on the other hand, they have aseptate, broad ribbon-like hyphae. That's the catchy word you should remember for mucormycosis. So anyway, here in this question, they've asked us about the risk factor, and we have already mentioned it is DKA. Next question, dear friends, a classical repeat type of a question, a repeat topic in general, that is malaria. Okay, so a patient has complaints of fever and rigorous chills. Microscopic examination image is shown below. Identify the organism. See, the options were plasmodiums, I believe, what was told to me. So now, if you look at this images, right, the image that was given in exam was the first one. Okay, but just for the sake of discussion, I've even put another image over here. So guys, how do you recognize whether it is Vivax or Falciparum, the most important agents in India? So I have told you that this guy called as Falciparum contains multiple rings within a RBC. Whereas if you see the Vivax agent, Vivax has single large ring within one RBC. So if you imagine this is the RBC, this is how the Vivax would be, one single large ring. Whereas multiple rings is a classical feature of Falciparum. All right. Next, another very important feature here, the banana-shaped gametocyte, which can be very easily identified as seen in this image, right? So banana or crescent-shaped gametocyte. So here, the correct answer to this question, without any doubt, would be Plasmodium falciparum. Now, another question from the board's favorite topic, that is malaria. A patient traveling from Assam developed fever, headache, seizures after a while. Now, please notice they've mentioned Assam here. Maybe they're trying to hint about the northeastern states, because we know the treatment is different in rest of the India when you compare it to the northeastern states of India. All right, let us read the question further. It was diagnosed as Plasmodium falciparum. All right, they've given everything. Now, what would be the treatment for this patient? Technically, as such, I'm sure most of us were thinking about northeastern states related to the Assam word that was mentioned here, and thinking about answering artemether with lumefantrine combination. That is the management that is given in the northeastern states, artemether plus lumefantrine. Whereas in the rest of the India, we give artesunate along with sulfadoxine or pyrimethamine. Okay, so that's the one. But this time, if you notice here, they have not given those options. You don't see any of the combinations over here. Okay, so they mentioned something though, headache and seizures, that is clearly hinting us about cerebral malaria. Okay, so Plasmodium falciparum, you know, is associated with cerebral malaria also. So let us just assume this is a complicated case of malaria, or it's a severe case of a malaria. See, easy way to remember this is whenever you have a severe problem, we use IV drugs. So what would be the treatment over here that should be given? IV artesunate from amongst the options that were mentioned to us. Okay, so since it was mentioned, there was no combination that was given, so we are going to go ahead with IV artesunate. See, what do we do whenever we have this complicated cases of malaria here? We give IV artesunate followed by the oral ACT. Okay, so that's the scenario. Chloroquine, you know, falciparum is already resistant to this drug. Mefloquine and doxycycline, these are the drugs that are given in prevention of malaria, prophylaxis of malaria. So the correct answer to this question, it would be IV artesunate. Next question. So this question I have discussed even in the 25 most important topics or 25 important questions we have discussed right before the examination. Right, you can see that video as well. You can find this question. A child that has a fever, a runny nose, headache, and a rash as shown in the image. So this disease was caused by single-stranded DNA virus. So I was told that this word single stranded DNA was also used. See, this is an entire giveaway question right here. See, either you see this image, you know it's a slap cheek appearance. Slap cheek appearance, I told you, you slap by 5 fingers, so it's fifth disease, also called by the name of erythema infectious. So like that, you can identify this. Or guys, how do you know this is parvovirus that is causing this? Parvovirus, they have given a hint here, single-stranded DNA virus. Who's the single-stranded DNA virus? Parvovirus. Remaining all DNA viruses are double-stranded. So what is the disease that is being mentioned here? Erythema infectiosum. Now the remaining three options are basically from herpes virus called as HHV6. So HHV6 causes sixth disease, also known as roseola or exanthem subitum. All right. Next question, guys. Condyloma acuminata is caused by. Now, with condyloma, we have two words as we may know. One is acuminata, another is lata. So condyloma acuminata, dear friends, it is caused by human papilloma virus as we know. Although they didn't mention this, the serotypes that can cause this are 6, 11. These are the ones that are associated with condyloma acuminata. So who causes condyloma lata? Condyloma lata, it is seen in syphilis. And who's the causative agent of syphilis? Treponema pallidum. All right. So anyway, since they asked condyloma acuminata here, the correct answer is HPV. All right, guys. Another question that was a repeat from the previous examination, mumps topic. So a child was brought to the hospital with swelling around pinna, painful salivary glands, and testicular swelling was also noted. Identify the causative organism. So this question, dear friends, as I told you, it's a repeat question. So the answer to this would be mumps virus. So mumps virus generally presents with parotitis. Okay, so that's why you see the swelling in and around the pinna over here. Now, complications of this disease include things like euphoritis or orchitis, etc. Okay, so correct answer, mumps. A patient has complaints of severe headache, fever, nuchal rigidity. A lumbar puncture was performed that shows so and so. On microscopy, the organism was noted to have differential motility, that is tumbling motility at 25 degrees and non-motile at 37 degrees. Identify this organism. So guys, a similar type of a question also we have done in the 25 most important topics for your examination. See, you should always remember one thing, like in this clinical type of questions, more or less, they can be just even one word that tells you what is the correct answer. For instance, even if we didn't know anything as such in this, all right, one word that is telling you that this is the correct answer, it is tumbling motility, or if you remember a little more detail, differential motility word. So Listeria is one agent that can cause meningitis. And we have learned that it does that in extremes of age groups, either in the neonates or older people. Okay, so that's about Listeria as the agent. So correct answer here, it is Listeria. In fact, I've also told you during our classes that motilities, they may be asked in a clinical type of a question instead of just asking it like a one-liner question. Who shows this in this motility? They might incorporate this motility word into some kind of a clinical vignette, and this is exactly what they have done as you see here. Next question, guys. A patient is admitted due to complaints of fever, cough, shortness of breath, splinter hemorrhages, etc. So vegetations on the valves were also noted. The organism was found to be a coccus or a cocci in chains. Optogen as well as bile solubility test resistant. Which of the following is most likely associated? Another question which was discussed pretty much in this kind of a format in the 25 most important topics. All right. First of all, they're mentioning cocci in chains. Who is the cocci in chains, dear doctors? It is Streptococcus. So at least I get to know that this is a Streptococcus. Next, they're using the word optochin. When we mention the optochin, I told you optochin sensitive is Streptococcus pneumoniae and optochin resistant is Streptococcus viridans. Anyway, since they have mentioned the word vegetations here, I know they're talking about endocarditis. And Streptococcus pneumoniae is not associated with endocarditis, right? So who is already ruled out here? Streptococcus pneumoniae. Who is optochin as well as bile solubility test resistant? It is Streptococcus viridans. Now, I mentioned some names under the viridans topic like mutans, sanguis, etc. I told you Streptococcus mutans is associated with dental caries, whereas the sanguis is associated with subacute bacterial endocarditis. So who was mentioned in the option here? It was sanguis. All right. So the correct answer to this question would be sanguis. A patient was treated with clindamycin for a recent infection. Shortly after the antibiotic course is complete, the patient develops diarrhea. What is the most likely causative organism in this scenario? Guys, another repeat from the 25 most important questions topic. Okay, so this thing we have learned that clindamycin and diarrhea, if you see these two words, they're talking about antibiotic associated diarrhea, right? And one of the important antibiotic they generally associate this with is clindamycin. Although there are others like cephalosporins, amoxicillin, ampicillin, etc. But clindamycin is generally, given for questions. All right. So what you should remember for this, who's the causative agent for this? The causative agent is Clostridium difficile. So here the Clostridium difficile would be the correct answer. All right. Yes, we can see EHEC, Shigella, they can also cause diarrheas. They are bloody diarrheas, but they're not due to use of, antibiotic as such. Okay. Bacillus cereus is related to the Chinese fast food poisoning. All right. Okay, so next question. A child was brought to the hospital with complaints of fever, difficulty swallowing. On examination, edema on the neck and a grayish-white coating was noted over the throat that started to bleed on an attempt to scrape it. Identify the organism associated. All right. One of the favorite topic as such for the board to ask is diphtheria. In one way or the other, either the culture media or the symptoms, something like that, they have been asking question on diphtheria. I've emphasized it enough in the class, as well as you can see the video. Even in 25 important topics, we have discussed this. I'm not saying this to brag about that we have discussed this, we have discussed that. This is just to tell you that these are the important topics that you cannot miss out on. Okay, and I really hope each one of you have answered this correctly. Okay, so who's the correct answer for this? Corynebacterium diphtheria. So this would be the correct answer, dear doctors. Corynebacterium diphtheria. Now mumps, it causes parotitis, the swelling in and around here. Okay, yes, some people may think it is bull's neck. No, not exactly. Bull's neck is a severe edema in this area. Mumps is inflammation in and around in this area. Okay, so that is about this agent. Streptococcus pyogenes causes sore throat. Another important agent for exam, Streptococcus pyogenes. And as such, whatever is mentioned here, it doesn't look like a pneumonia case. So that being ruled out. Plain and simple, another question. Granuloma inguinale is caused by. So this granuloma inguinale, it is caused by an agent called as Klebsiella granulomatis. This would be the correct answer for this. This guy was formerly called as Calimatobacterium granulomatis. Okay, so the disease caused by this is called as granuloma inguinale, also called as Donovanosis. Now we know the classical presentation of this would be a beefy red ulcer on the genitalia, right? So beefy red ulcer is the presentation. And then we have talked about the safety pin appearance that is seen with Klebsiella granulomatis. Now, what are these bodies known as? Donovan bodies. A female presented with a vaginal discharge. Microscopic examination showed clue cells. If the words like discharge, vaginal discharge, clue cells, whiff test, anything is mentioned, you know they're talking about this thing called as bacterial vaginosis. Right, doctors? So Amsel's criteria is used for the diagnosis of this agent known as Gardnerella. So guys, what is the drug of choice for this condition? We all know the preferred agent here, it would be metronidazole. So if you guys recall this thing, we have learned this mnemonic called as get back on metro. Get back on metro. Metro is metronidazole. So what was the word here? G for two agents. One was Giardia lamblia, another was Gardnerella, right? E for Entamoeba histolytica, and T for Trichomonas. Trichomonas also, the drug we use is metronidazole. So this is it. Next question. A patient shows resistance to isoniazid, rifampicin, kanamycin, and fluoroquinolones, fluoxetins basically, right? So this type of resistance is known as. Now the options: monodrug resistant TB, multi-drug MDR TB, and extensively drug resistant, that is XDR TB. So guys, you should all understand monodrug resistance means if the tubercular agent is resistant to one of the first line drugs of TB, that is known as monodrug TB. Okay. Next, multi-drug resistant MDR TB. This one is a condition in which the TB agent is resistant to both isoniazid as well as rifampicin, right? So that is MDR TB. Next one, MDR TB plus resistance to injectable drugs like kanamycin. You know, the other injectable drugs used in TB are streptomycin, okay, amikacin, capreomycin. These are the injectables that are used in tuberculosis, and even fluoroquinolones. So if you have resistance to this, it is known as extensively drug resistant TB. So the correct answer to this question, it would be extensively drug resistant TB. As I mentioned, what is XDR TB? It is nothing but MDR TB. In addition, what do you have here? You have resistance to one of the fluoroquinolones and even injectables. A patient was diagnosed with tuberculosis. Which of the following stains would be used for this? For this, obviously, the correct answer is Zn stain, Ziehl-Neelsen, right? Or acid-fast stain. So this, I'm sure, is not the exact framing of the question, but I was told that a question was asked this way, and then in the options, they could see Zn stain. Next question, E. coli can be best grown on. So you see the agars like DCA over here, XLD, SS, and McConkey's. Now, as such, doctors, you should all understand the first three options are the preferred ones for Shigella or Salmonella. Okay. Deoxycholate citrate agar, DCA, or XLD, SS agar, these are the ones preferred for Shigella and Salmonella. In fact, SS stands for Shigella Salmonella agar. Alright, so if you had to choose one option amongst this for E. coli, then we would go with McConkey's. Okay, because on deoxycholate citrate agar, etc., E. coli growth is seen very poorly, or in fact it is negligible. Alright, so that's why from amongst the following we would go with McConkey's agar as the answer. Another question which I didn't get the exact options, etc. for. A child with a history of sore throat who was later found to have cola colored urine. Okay, what is the most likely diagnosis? So guys, it's a very classical presentation of this agent called as Streptococcus pyogenes. also called as group A streptococci. Now we have learned that when you get an infection with this agent, usually a child is mentioned, in this scenario, and the child may have had sore throat history. And then what you should remember, doctors, it can get complicated in two ways. One is rheumatic fever, another is PSGN or acute glomerulonephritis. Okay, so PSGN is post-streptococcal glomerulonephritis or acute glomerulonephritis. So if this was mentioned in the options, PSGN or acute glomerulonephritis, then that is the answer for this. All right, guys. So next questions here. Now, I did not get a proper framing of these questions nor the correct options to this. But since many students have mentioned something related to this, I just wanted to mention this. They have mentioned something in sort of this kind of lines here, that is a cheap test that can be used for the diagnosis of syphilis. The answer to this would be VDRL, but then that was not there in the option. I believe dark field microscopy was mentioned. So if they mentioned dark field microscopy, which was a related option, and you could not see any other test for the syphilis, then probably that is the correct answer. Okay. I hope you guys remember that that is the microscope on which you see that corkscrew motility of this agent. Next, another question that was asked in this kind of lines, that is antibody dependent enhancement concept. You all know that this ADE, antibody dependent enhancement, it is seen with dengue fever. If you are affected with one of the serotypes, especially if you get affected by the serotype 1 of dengue fever virus, followed by the second serotype later in the life, what happens? This increases the risk of severe infections, that being the dengue hemorrhagic fever and dengue shock syndrome. Okay, so if that was in the option, that means the disease was mentioned, then dengue is the answer to this question. All right, so that finishes the discussion of the recall over here. I hope you guys were able to solve the questions at ease and were comfortable with all these questions. I wish all of you very best that you guys pass this exam with flying colors. Okay, so that's it from me. That's my time. Thank you so much, guys.